Hello kids! Welcome to our lesson for PE and Health 4. And this video will cover week 3 to week 6. And we're going to discuss about current health status and body awareness. So are you ready? Alright, so let's start our lesson for this weeks. Okay, so we're going to cover week 3, 4, 5, and 6. Okay, so I think this is just the summary of your lessons for those weeks. Okay. So for our content standards and lesson competencies, so students will gain an understanding of hygiene practices, health assessments, and target games. In performance standards, students will actively participate in health practices and target games to promote wellness. And for learning competency, this is what do we need to learn for this week's, is that you will going to relate your current health status to body awareness. Okay, so for our current health status and body awareness, for this topic we're going to discuss about height and weight measurement, or your BMI, hearing tests, vision screening, and scoliosis exam. So for height and weight measurement, for your BMI, so BMI is a measure of body fat based on height and weight, providing insights into individual health status. While hearing tests evaluate hearing ability and identify potential issues that require further attention. Vision screening checks in visual acuity, detecting potential problems like nearsightedness or farsightedness. Scoliosis exams assesses the curvature of the spine, identifying potential spinal deformities. Okay, so let's start off with body mass index, or the BMI. BMI is a measure of body fat based on height and weight. It helps to identify if someone is overweight or underweight. BMI is calculated by dividing a person's weight in kilograms by the square of their height in meters. A BMI of 18.5 to 24.9 is considered healthy, while a BMI of 25 to 29.9 is considered overweight, and a BMI of 30 or higher is considered obese. Okay, so BMI is considered important because it's simple, easy, and accurate way to assess body fat percentage. It can help doctors and healthcare providers monitor weight and identify potential health risks. However, it is important to note that BMI is not a perfect measure of health. Some people may have a high BMI but be healthy, and others may have low BMI but be unhealthy. So there are other ways to measure health besides BMI, such as waist circumference, body fat percentage, and muscle mass. It is important to consult with a healthcare provider to determine your individual health needs and goals. So this BMI, can you remember during the first month of your classes? So as the opening of classes begins, so teachers, and of course most of the teachers, were advised to get your height and weight, and then in a certain template, it will automatically calculate the BMI of the students, so to determine if they are underweight, overweight, and obese, or if they are in normal. So kumbaga kung normal yung kanilang weight for their height. Okay, so that is BMI. So every first month and at the end of the school year, so every beginning of the school year and end of the school year, chine-check yung body mass index or BMI of the students. So chine-check nila if how many of their students are in the normal weight and height. So how many are underweight, and then how many are overweight and then obese. So those who falls into the underweight, so they are the ones being considered as yung beneficiary ng SBFP or the school-based feeding program. Okay, but then according to the slide, BMI is not merely a perfect measure for health. So, meron pang ibang ways para ma-measure if a person is healthy or unhealthy. But then, it is a way to check if a child, a student, or a person is having a normal weight or underweight, overweight, and then obese. So, isa siya sa mga determining factors din ng health, although it is not a perfect one. So, meron pang other ways to assess if a person is healthy. So, how do we calculate our BMI? So, for body mass index or BMI is calculated by dividing weight in kilograms by the square of height in meters. So, for example, if your weight is 70 kilograms and your height is 1.75 meters, your BMI would be, so, yan yung operation. So, it will be 22.86. So, titingnan mo lang doon sa table if it will fall in the normal or normal weight, underweight, overweight, or obese category. Now this time, let's go to hearing tests. So understanding your hearing health. So we have audiometry testing. Audiometry measures hearing sensitivity using sounds at different frequencies and volumes. This helps pinpoint areas of hearing loss. While ear examination, a doctor may examine the ears to check for signs of infection, blockage, or other abnormalities that could affect hearing. And then we also have sound recognition. This test involves identifying sounds like speech or music at varying volume to assess your ability to understand and interpret them. So, ito yung mga hearing test na ginagawa to assess our hearing. So we have here other types of hearing tests. We have pure tone testing. This common test identifies the quietest sound you can hear at different pitches. It's used for both children and adults. Speech testing. This test involves listening to and repeating spoken words to assess your ability to understand speech. It's used for adults and some children. We have also autoacoustic emissions, or what we call as OAE. This test checks the function of your inner ear. We also have bone conduction testing. This test checks if your ear canal or middle ear is blocked, or if there are problems with the sensory cells responsible for hearing. We also have auditory brainstem response, or ABR. This test checks the connections between your inner ear and brain. It's used for children and people who can complete other hearing tests or who have brain injuries affecting their hearing. And we also have tympanometry. This test checks how well your eardrum moves. It can help identify problems like a ruptured eardrum or fluid in the middle ear. Now let's have vision screenings, a quick check. So we have eye chart test. So this is the most common vision screening that we undergo. A vision screening involves reading letters on an eye chart to assess your vision. And then we also have comprehensive eye exam. A complete eye exam checks your vision and eye health, looking for signs of serious eye disorders that may not have symptoms such as glaucoma. A vision screening is a brief test that mainly checks how well you can see things up close and far away. It's also called an eye test. The test usually involves reading letters on eye chart. A vision screening is a quick way to find out if you need a comprehensive or complete eye exam. A complete exam checks both your vision and eye health. It looks for signs of serious eye disorders that may not have symptoms such as glaucoma. Okay, so we have checking for common eye conditions. So these are the most common eye conditions that we have nowadays. So lalo na ngayon, no, yung mga bata, napakaaga nilang ma-expose sa screen, 'di ba? Mula nung nagkaroon, nauso yung computers and now the cell phones, naging mas exposed yung mata ng mga bata or learners, diba, as early as 1, as early as 2 years old na exposed na sila sa radiation, no, na nai-emit ng mga computers and cell phones and tablets. So these are some of the common eye conditions. So kaya nga sabi ng mga pediatrician, so as much as possible, no screen time for children ages 1 to 5, or kumbaga hanggat maaari, hindi mo na dapat sila in-expose sa cellphones, tablets, or television. So hanggat kaya. Kaso, nowadays, so napakahirap because for some moms, yun yung way lang nila para maging busy yung bata. Pero of course, there are some other ways how to keep our children busy instead of watching through cell phones or watching via computers. So the first common eye condition is the amblyopia. Amblyopia is a vision problem that happens when the brain and one eye don't work together well. It's often called lazy eye. Amblyopia is the most common cause of vision loss in children. Next, we have strabismus. Strabismus causes one or both eyes to turn in or out, often called cross eyes or yung pagkaduling, or wall eyes. If not corrected, it can lead to amblyopia and eye damage. Next, we have the nearsightedness or myopia. Myopia makes it hard to see distant objects clearly. It's a common vision problem that can be corrected with eyeglasses or contact lenses. And we also have farsightedness or hyperopia. Hyperopia makes it hard to see objects up close. This condition is also called farsightedness and is often corrected with glasses. Next, we have scoliosis test. Scoliosis screening. A scoliosis screening is quick check to see if a child has a curvature of the spine. And then we also have scoliometer. The scoliometer is a device used to measure the angle of the curve in the spine. Okay, so let's further discuss what scoliosis is. A scoliosis exam allows doctor to see whether the spine has a curve. People with scoliosis can have a single curve creating a C shape or a double curve creating an S shape. Now, how is scoliosis examined? Scoliosis exams are physical examinations involving exercise that allow a doctor to see the shape of the spine. They are neither painful nor invasive and they require no preparation. When does scoliosis appear? Scoliosis sometimes appear as a child or teenager grows and develops. Detecting scoliosis at this stage allows a doctor to monitor the curve of the spine and recommend treatment if the curve is severe enough to warrant. Then we also have types of scoliosis exams. A scoliosis exam is a type of physical examination that a doctor performs in their office. There are two types. So we have the screening test, which look for warning signs that a person may have scoliosis, and diagnostic test, which confirms scoliosis and assesses the severity of the curve in the spine. A person with a positive screening test may require a diagnostic test. And then scoliosis screenings, a history. Previously, scoliosis screenings were part of routine child health visits. Now, concerns about overdiagnosis and overtreatment mean that many organizations do not recommend this approach. And current screening recommendations, those in favor of screening recommend that it takes place twice in females aged 10 to 12 years and once in males aged 13 to 14 years old. So these are some of the scoliosis screening tests. So we have the Adams test. This screening test involves bending forward with knees straight and feet together. Doctors look for a visible curve in the spine, asymmetries in shoulders, or a hump on one side. Scoliometer, if the Adams test reveals signs of scoliosis, a doctor may use a scoliometer to measure the angle of the curve. This device helps determine the severity of the curve. And we also have medical imaging. Neither the Adams test nor a scoliometer provides a complete picture of the spine. If scoliosis is suspected, doctors will refer the person for medical imaging to confirm a diagnosis. Okay, so now let's have the integumentary system. So its primary purpose is for protection. Number 1, protection. The skin acts as a barrier against microorganisms, chemicals, and other environmental factors. So, yung skin talaga natin ang nagpuprotekta sa ating mga organs, no, internal organs. And ito yung unang sumasala, no, ng mga harmful elements na pwedeng pumasok sa ating katawan. Number 2, preventing dehydration. The skin helps the body retain moisture and prevent dehydration. We also have sensory organ. The skin allows us to feel touch, temperature, and pain. Temperature regulation. The skin helps regulate body temperature through sweating and blood flow. So, di ba kapag nilalagnat tayo, mas gusto natin yung pinagpapawisan tayo para ma-release yung body heat natin. And then, para mag-cool down yung ating katawan. Then, we also have vitamin D protection. The skin synthesizes vitamin D when exposed to sunlight. Okay. So this time, let's discuss the skin, the hair, and the nails. And we also have the sweat glands. And then later on, we're going to this one by one. So for the skin protects the body from various external threats, regulates temperature, and contains sensory receptors. For the hair plays a role in protection, sensory input, thermoregulation, and communication. Nails are specialized structures of the epidermis, protecting the tips of fingers and toes from mechanical stress. And of course, we also have the sweat glands, which produce sweat to cool the body, regulating temperature, and maintaining homeostasis. Okay, so let's start with the skin. So, of course, the skin has three layers. We have the epidermis, the outermost layer of the skin, providing a barrier against infection and water loss. Next, we also have the dermis. It contains blood vessels, nerves, hair follicles, and sweat glands. Hypodermis is the deepest layer of the skin, which stores fat and helping insulate the body. The skin is the largest organ of the human body, protecting the body from external threats, regulate body temperature, and containing sensory receptors. So ito yung largest organ ng ating katawan na nagpoprotekta sa ating mga internal organs and at the same time from external threats. And it helps in regulate our body temperature. So yun yung sinasabi natin kapag ilalagnat tayo, mas gusto nating pagpawisan tayo or kapag napapansin natin kapag tayo ay nag-exercise, diba? Nag-burn yung ating mga body fats and it turns out as sweat, diba? Yung nag-excrete siya ng sweat. And it contains sensory receptors, so ito yung nag-enable sa atin maka-feel ng pain, ng heat, no? Kapag mainit, kapag malamig, nararamdaman natin through the skin. Because of the sensory receptors. So we also have the skin color. So we have the freckles. Freckles appear when melanocytes cluster in the skin. Melanin is the darkest, and is the color of the skin or the pigment. The darker skin tones have more melanin than lighter skin tones. We also have sun protection, exposure to sunlight, or tanning. Beds increases melanin production, resulting in a tan. This tan protects the DNA of skin cells from sun damage. Kasi pag too much exposure naman sa sun, it can cause skin cancer. Then moles, yung ating mga tagyawat. Moles are larger groups of melanocytes. While most are harmless, it's important to monitor them for any changes that might indicate skin cancer. Okay, so now let's talk about the hair, the crowning glory. Okay, so hair is made of dead, keratinized cells originating in hair follicles. It serves various functions including protection, sensory input, thermoregulation, and communication. Hair on the head protects the skull from the sun. Eyelashes and hair in the nose and ears trap dust particles. So yung ating mga eyelashes, tumutulong siya para hindi pasukan ng particles, basta-basta mapasukan ng kung anumang particles yung ating mga mata. And then, yung ating hair sa nose, no, ito naman, ang ears, ito naman din yung sumasala para hindi makapasok yung mga external elements, yung mga maliliit na mga, basta kumbaga tinatrap niya yung mga bagay-bagay like dust, 'di ba? Para hindi makapasok ng tuluyan sa ating nose, especially sa ating ears din. Okay, so hair also has sensory function, being sensitive to air movement. This is useful for detecting insects and other potential harmful substances. The erector pili muscle contracts to make hair stand up, trapping air for insulation. Now let's have the nails. We have the nail bed and the nail body. The nail bed is specialized structure of the epidermis found at the tips of our fingers and toes, while the nail body formed on the nail bed protects the fingertips from mechanical stress while being used and act as a back support for picking up small objects. Next, we have the sweat glands. So we have different types of sweat glands. We have the eccrine sweat glands, which are found all over the body. They release hypotonic sweat, which is primarily composed of water. This sweat helps regulate body temperature. We also have apocrine sweat glands. Apocrine sweat glands are located in hairy areas like armpits and genital region. They secrete thicker sweat containing organic compounds which can lead to odor. Next, we have antiperspirants. Antiperspirants work by blocking the sweat gland duct with aluminum-based compounds. This prevents sweat from reaching the surface of the skin. Okay, so yung sweat glands, ito yung nag-enable sa ating katawan para magpawis. Diba? So, yung iba, ayaw na pinagpapawisan, yung iba naman gustong-gusto. Kasi syempre, yung pawis natin, yung sweat, isa yan sa mga waste ng ating katawan. So, mahalaga na nakakalabas yan sa ating katawan. And for some, especially, diba, yung banda sa ating armpit and then sa genital region, so lagi dapat natin yung pinupunasan and then hinuhugasan para hindi mag-create ng odor. Especially yung sa ating armpits, diba? So, yung responsible dyan is yung apocrine sweat glands. But then, of course, sweat glands are very important kasi nga, it helps, ito yung nakakatulong din, yung pawis, nakaka-release to ng heat, no, ng ating sa katawan. Kumbaga, nare-release niya, and then, aside from, na tumutulong siya sa pagre-regulate ng temperature ng katawan is nare-release niya yung mga waste product din ng ating katawan, no? So, kaya 'di ba parang yung sweat natin maalat kasi nga waste product yan ng ating katawan. Alright, this time let's have the dental exams. The dental exams are important for protecting your oral health. Oral health includes your teeth, gums, and the muscles and bones that let you smile, speak, and chew. Common problems like tooth decay or cavities and gum disease like periodontal disease can lead to pain, infection, and tooth loss. Poor oral health can also affect your general health. For example, losing teeth can cause problems with eating and nutrition, which can lead to other health problems. You can help prevent oral health problems with regular visits to the dentist and good toothbrushing and flossing habits at home. Okay, so we have here dental examination. So we have teeth cleaning. Professional teeth cleaning removes tartar and plaque, preventing tooth decay and maintaining oral health. We also have visual inspection. A thorough visual inspection allows the dentist to identify any potential dental issues. We also have oral cancer screen. Oral cancer screenings detect early signs of oral cancer, facilitating timely treatment. We also have fluoride treatment. Fluoride treatment strengthens tooth enamel, reducing the risk of cavities. In bite inspection, the dentist examines the alignment of teeth and jaw, identifying potential bite issues. So it is very important to visit our dentist regularly. Okay, now let's understand health risk. So let's identify health. So how do we identify health concerns? So being aware of potential health risk is crucial for proactive health management. Regular checkups and consultations with healthcare professionals help identify early signs and address potential issues. And adopting a holistic approach to health involves addressing physical, mental, and emotional well-being. So it's promoting overall well-being. Okay, so how do we improve your chances for good health? So of course, we need to identify the risk of infection. A nearby sneeze can raise your risk of catching the flu. Risk of diabetes, obesity boosts the odds you'll get diabetes. So, ito yung medyo tumataas yung cases natin of diabetes, no? Yung mga as early as kumbaga mga bata pa nagkakaroon na sila ng diabetes because dati sabi it's because of the genes, but nowadays hindi na raw yun yung case. It is about the lifestyle that we have. So syempre kapag tayo ay kain ng madami, ang tendency tataba tayo and then hanggang sa maging obese na. And kapag obese ang isang bata or isang adult, tumataas yung chances na magkaroon siya ng diabetes, no? Hindi lang ito because of eating too much sweets, but then yung pag-eat natin masyado ng halimbawa yung maraming mga processed foods, yung mga masasarap na pagkain sa fast foods, no, ito yung mga mabilis makapagpataba sa atin. And kapag hindi tayo nakapag-exercise regularly, lagi yung lifestyle natin nakaupo, hindi tayo masyado gumagalaw-galaw, so tumataas yung risk of having diabetes and other health problems. So risk of cancer, smoking increases your risk for many cancer. So health risks can sometimes be confusing, but they're important to understand. Knowing the risk you and your family may face can help you find ways to avoid health problems. So of course, kapag halimbawa alam nyo nasa lahi nyo na, so try to avoid. Halimbawa nasa lahi nyo na yung pagiging diabetic. So as early as now, huwag ka nang masyadong kumain ng mga matatamis kasi kumbaga yung chances mo na magkaroon ng diabetes is mas mataas kaysa doon sa walang lahi. Kasi kumbaga, nasa blood na natin yon, nasa genes na natin yon. Eh kapag patuloy pa tayong kumain pa tayo ng marami, hilig-hilig natin sa mga chocolates and everything, so mas tataas talaga yung chance na magkakaroon din tayo nito in the near future. So it can also keep you from fretting over unlikely threats. Knowing the risk and benefits of medical treatment can help you and your doctor make informed decisions. So for illness, here are the tips to help you recover. So number 1, healthy diet. Medical conditions, illness, or injury are frequently stressful and may disrupt our lives. A healthy diet, regular exercise, sleep, and social support can relieve or manage the symptoms of illness or injury and help improve recovery. So we also need regular exercise. A healthy diet, regular exercise, sleep, and social support can relieve or manage the symptoms of illness or injury and helps you improve kumbaga mas madali ka maka-recover. So, para-parehas lang pala siya. Okay, so these are the things that you need for you to recover quickly from illness. Healthy diet, regular exercise, adequate sleep, social support. So, taking a positive view can also make a huge difference to recover from illness. Worrying or negative thinking. So we have ito yung isa sa mga common na lalo na nung nag-arise ito lalo during the pandemic. So maraming nagkaroon ng nagwo-worry, 'di ba? And marami talagang naapektuhan and nagsuffer yung mental health ng tao because of the pandemic. So stress and anxiety, worrying and negative thinking can contribute to anxiety and stress levels, negatively affecting your health. Diba kapag masyadong negative yung pananaw natin sa buhay, parang ang bigat-bigat lagi ng pakiramdam natin and parang wala tayong motivation to pursue at para i-continue yung ating buhay. Parang so it really affects our whole being. Then write down your concerns. So writing down your worries and potential outcomes can help you identify solutions and cope with challenging situations. Seek professional help. Seeking support from a therapist therapist or psychologist can provide valuable guidance and coping strategies for managing anxiety and worries. And engage in activities. Find diverse activities to focus on each day. Even if you can only manage short periods at a time, make sure your day is varied and challenging. Okay. Stress and tension can affect you physically in many ways, including increased muscle tension and chronic contraction. So learn to recognize the signs of tension in your body. Stop regularly and think about it. Think about how muscles in your body feel. Identify those muscles that seem most tense when you feel stressed. Usually, sumasakit yung batok natin, and then sometimes likod. Yung iba naman, ulo. So, learn to think about kung ano ba yung sumasakit sa'yo, yung kapag ikaw ay natetensyon or kapag ikaw ay nasistress. Regularly practice slow and deep breathing. So, yung kumbaga, learn to yung breathing exercise, no, para kumalma ka. Deep breathing using abdominal muscles is preferable to shallow breathing relying on chest muscles. Learn to take time out to relax. For example, think of pleasant images and listen to music to calm you. So, we have different ways on how we're going to relax. Yung iba, gusto mag-travel. Yung iba, gustong matulog. Yung iba, gusto maglakad-lakad. And others would like to do sports, jogging. Yung iba, nag-exercise or nag-lift ng weights. And for some, okay na sa kanila yung manood ng TV, spend the weekend na wala silang ginagawa. That's their way of relaxing. Then, learn a deep muscle relaxation technique. Or yung iba, nag-yoga sila. For example, a progressive muscle relaxation, that is a method of systematically contracting and relaxing your muscles. So, see a psychologist for training. So, of course, diet, exercise, and sleep. This is very important. A healthy diet can help you to cope with a medical condition, illness, or injury. Regular exercise can help you to cope with... Okay. So, same thing din, no? Aside from healthy diet, regular exercise, and adequate sleep, so this can all help you cope with a medical condition, illness, or injury. Sometimes, the medication and treatment for a condition or the pain caused by it can have an impact on your appetite, energy levels, and sleeping patterns. So, talk with your doctor about ways of managing these unwanted effects of medication. Okay, so how to improve your diet? Number 1, eat regularly. Try to eat smaller, more frequent meals rather than 1 or 2 heavy meals. Next, choose nutritious foods. Choose foods that you enjoy and that are good for you. This will make it easier to stick to your diet. Eat small amounts often. Even if you're not hungry, try to have a small snack every few hours. This will help to keep your energy levels up and prevent you from getting too hungry. Then, avoid inappropriate foods. Try not to keep unhealthy foods in the house. This will make it easier to resist temptation. Siyempre, yung mga junk foods natin, so too much chocolates, yung mga processed foods natin, no? Dapat in moderation lang din. Then, tell your family. Let your family and friends know about your diet so they can support you. So, it is very important kapag meron tayong support system. Hindi yung gusto mong mag-diet pero pagtatawanan ka, naku, hindi mo na naman kaya yan. So, parang someone should support you. So, it should start with the family. Na, sige, kaya mo yan. You can do this. And then, eventually, kapag nag-start na, yung lahat ng meal nyo will be healthy na. Diba? Kumbaga, hindi lang ikaw, but at the same time, yung buong family, ma-encourage mo na rin sila to have a healthy diet, di ba? Hindi naman yung diet na talaga magpapapayat, pero encourage them to eat healthy. Okay, so also remember to keep active. Okay, so like increasing your physical ability, getting enough sleep, and getting enough support. So from families and friends. So aim for some physical activity every day, even if it's just small amount. Talk to your doctor about exercise that's right for you to help you get a good night's sleep. So ngayon, very trendy ngayon yung 10,000 steps, 'di ba? Yung achieving 10,000 steps in a day. So it will help you be healthy. So avoid naps during the day. Only lie in bed if you're going to sleep, not for watching TV. Avoid stimulants like tea or coffee at night. Exercise during the day to help your body prepare for sleep. And to build and maintain support, schedule time to connect with the family and friends. Tell your loved ones about your condition and how they can help, and consider joining support groups, clubs, or volunteering. Alright, so to sum up, identifying health concerns and corrective actions. So health concerns recognize potential health concerns based on the assessment. Corrective actions develop strategies to address and mitigate identified health concerns. Health improvement implement healthy habits and lifestyle changes to promote overall well-being. And for enhancing our health awareness, so of course, again, physical activity, encourage regular physical activity, promoting cardiovascular health and overall fitness. Have a healthy diet, emphasize the importance of a balanced and nutritious diet, providing essential nutrients. Adequate sleep, promote sufficient sleep, ensuring proper rest and rejuvenation for optimal health. So sleep is very important. Hydration, stress the importance of staying hydrated, replenishing fluids for body function. So it is very important to keep and be hydrated all the time. So drink at least 8 to 10 glasses of water every day. Water, not soft drinks, not juices, not teas, not milk tea, not coffee. So water. Wag po nating gawing tubig ang soft drinks, wag nating gawing tubig ang juices and coffee. So water is very important, so to flush out yung mga toxins inside our body. So this ends our lessons for week 3, 4, 5, and 6. So let's have it under we had it for 40 minutes. So thank you for being with me, and I hope na you learned something from our lesson for today. So this is Teacher Isa. Thank you so much for being with me. See you again next time. Bye!